Did you know that a simple vitamin could be protecting you from countless health problems without you even realizing it? Yes, vitamin E is that silent guardian, working behind the scenes to keep you healthy. This unsung hero, vitamin E, plays a crucial role in maintaining overall well-being. Found in a variety of foods, it's easier than you think to incorporate it into your diet. Often overlooked, vitamin E is a fat-soluble vitamin that acts as a powerful antioxidant, shielding your cells from damage and promoting optimal health. It combats oxidative stress, which can lead to chronic diseases. Let's delve deeper into the world of vitamin E and discover its remarkable benefits. From boosting your immune system to improving skin health, vitamin E is indispensable. Vitamin E is not just one compound, but a group of 8 related compounds. These include 4 tocopherols and 4 tocotrienols, each with unique properties. The most active form in the human body is alpha-tocopherol. This form is particularly effective in neutralizing free radicals and protecting cell membranes. Being fat-soluble means that vitamin E is stored in our fatty tissues and liver, ready to be utilized when needed. This storage mechanism ensures a steady supply, even when dietary intake is low. This storage capacity highlights its long-term benefits and emphasizes the importance of maintaining adequate levels. Regular intake of vitamin E can support cardiovascular health, cognitive function, and even reduce the risk of certain cancers. Vitamin E's claim to fame lies in its potent antioxidant properties. Antioxidants are like vigilant guardians, protecting our cells from the damaging effects of free radicals. Free radicals are unstable molecules generated during normal bodily processes like metabolism and also from external sources like pollution and smoke. These unstable molecules can damage our cells, leading to inflammation and contributing to chronic diseases. Vitamin E steps in as a powerful antioxidant, neutralizing these harmful free radicals and preventing them from causing cellular damage. This protective action helps to maintain the integrity of our cells and tissues, promoting overall health and longevity. Vitamin E is renowned for its remarkable skin benefits, earning its reputation as a beauty vitamin. Its moisturizing properties help keep the skin hydrated and supple, combating dryness and promoting a youthful appearance. Furthermore, vitamin E's antioxidant prowess helps protect the skin from environmental damage, particularly from the sun's harmful ultraviolet rays. UV radiation generates free radicals in the skin, leading to premature aging, wrinkles, and age spots. Vitamin E's antioxidant action neutralizes these free radicals, minimizing sun damage and promoting skin health. While vitamin E cannot replace sunscreen, it acts as a valuable complement to your sun protection routine. Beyond its skin-enhancing benefits, vitamin E plays a crucial role in maintaining cardiovascular health. It helps lower levels of LDL cholesterol, often referred to as bad cholesterol, which can build up in the arteries and increase the risk of heart disease. Furthermore, vitamin E protects against the oxidation of LDL cholesterol. When LDL cholesterol becomes oxidized, it contributes to the formation of plaque in the arteries, a condition known as atherosclerosis. This plaque buildup narrows the arteries, restricting blood flow and increasing the risk of heart attack and stroke. Vitamin E's antioxidant action helps prevent this dangerous oxidation process, protecting the arteries and promoting heart health. Section 5. Boosting immunity with vitamin E. A robust immune system is essential for fighting off infections and maintaining overall well-being. Vitamin E plays a crucial role in supporting immune function, acting as a potent antioxidant that protects immune cells from damage. These immune cells are responsible for identifying and destroying harmful pathogens that enter our body. By protecting immune cells from oxidative stress, vitamin E ensures their optimal function, allowing them to effectively combat infections and keep us healthy. Studies have shown that vitamin E supplementation can enhance immune response, particularly in older adults, who are more susceptible to infections. Section 6. Vitamin E, a vision for healthy eyes. Our eyes are delicate organs that are constantly exposed to environmental stressors such as UV radiation and pollution. These stressors can generate free radicals that damage the sensitive cells in our eyes, leading to age-related eye conditions like cataracts and macular degeneration. Vitamin E, with its potent antioxidant properties, helps protect the eyes from this oxidative damage. Studies suggest that a diet rich in vitamin E may lower the risk of developing cataracts, a clouding of the eye's natural lens that can impair vision. Additionally, vitamin E may play a role in protecting against macular degeneration, a leading cause of vision loss. Section 7. Vitamin E and the nervous system. The nervous system, which includes the brain, spinal cord, and nerves, is a complex network that controls bodily functions and transmits signals throughout the body. Vitamin E plays a crucial role in maintaining the health and function of this vital system. Its antioxidant properties protect nerve cells from damage caused by free radicals. Oxidative stress is believed to contribute to the development of neurodegenerative diseases, such as Alzheimer's and Parkinson's. Vitamin E's antioxidant action may help protect against this damage, potentially reducing the risk of these debilitating conditions. However, more research is needed to fully understand the role of vitamin E in neurodegenerative diseases. Section 8. Recognizing the signs of vitamin E deficiency. While vitamin E deficiency is relatively uncommon, certain individuals may be at risk, particularly those with underlying medical conditions that affect fat absorption. Recognizing the signs and symptoms of vitamin E deficiency is crucial for early intervention and preventing complications. One of the most noticeable signs of vitamin E deficiency is dry, flaky skin. Muscle weakness and fatigue are also common symptoms, as vitamin E plays a role in muscle function. In severe cases, vitamin E deficiency can lead to vision problems, including blurred vision and difficulty seeing in low-light conditions. Section 9. When vitamin E runs low, deficiency risks and causes. Vitamin E deficiency can arise from inadequate dietary intake or factors that impair the body's ability to absorb and utilize this vital nutrient. Certain medical conditions such as Crohn's disease and cystic fibrosis can interfere with fat absorption, increasing the risk of vitamin E deficiency. Premature infants are also at increased risk of vitamin E deficiency due to their low birth weight and underdeveloped digestive systems. Additionally, people following very low-fat diets may not be consuming enough vitamin E-rich foods, putting them at risk of deficiency. Section 10. Replenishing vitamin E, dietary sources, and cooking tips. In this section, we will explore the various dietary sources of vitamin E and provide some useful cooking tips to help you retain its nutritional value. The best way to ensure adequate vitamin E intake is to consume a balanced diet rich in vitamin E-rich foods. Incorporating a variety of these foods into your daily meals can help you meet your nutritional needs. Plant-based oils such as sunflower, safflower, and wheat germ oil are excellent sources of vitamin E. These oils can be used in salad dressings, cooking, and baking to enhance both flavor and nutrition. Nuts and seeds, particularly almonds, sunflower seeds, and hazelnuts, are also good sources. Snacking on a handful of these nuts or adding them to your meals can boost your vitamin E intake. Leafy green vegetables such as spinach and kale and fortified cereals also contribute to vitamin E intake. Including these vegetables in salads, smoothies, or as side dishes can be beneficial. It's important to note that cooking methods can affect vitamin E levels in food. Choosing the right cooking techniques can help preserve the nutrient content. High-heat cooking, such as deep frying, can destroy some of the vitamin E content. Therefore, it's advisable to limit the use of such methods to retain the vitamin's benefits. Steaming, baking, and stir-frying are preferable cooking methods for preserving vitamin E. These methods not only maintain the nutritional value but also enhance the natural flavors of the food. Section 11. Vitamin E supplements. Proceed with caution. Vitamin E is a vital nutrient that plays a crucial role in maintaining our overall health. It acts as an antioxidant, protecting our cells from damage and supporting our immune system. While obtaining vitamin E from a balanced diet is ideal, it can be found in a variety of foods such as nuts, seeds, and green leafy vegetables. These natural sources provide a host of other nutrients that work synergistically with vitamin E. Supplements can be beneficial for individuals who are unable to meet their needs through diet alone. This includes people with dietary restrictions, certain health conditions, or those who have higher nutritional requirements, or those with specific medical conditions. For instance, individuals with fat malabsorption disorders may require supplements to achieve adequate vitamin E levels. However, it's crucial to consult with a healthcare professional before taking vitamin E supplements. They can provide personalized advice based on your health history and current medications. High doses of vitamin E supplements can interact with certain medications, such as blood thinners, and may lead to adverse effects, and may increase the risk of bleeding. This is particularly important for individuals who are already at risk for bleeding disorders or are taking anticoagulant medications. Your healthcare provider can help determine the appropriate dosage of vitamin E supplementation based on your individual needs and health status. They will consider factors such as your age, diet, and any existing health conditions. Remember, maintaining a healthy lifestyle with a balanced diet rich in fruits, vegetables, and whole grains is the foundation for optimal vitamin E levels and overall well-being. These foods not only provide vitamin E but also other essential nutrients that contribute to your health, is the foundation for optimal vitamin E levels and overall well-being. By focusing on a nutrient-rich diet, you can support your body's natural defenses and promote long-term health. Always prioritize whole foods over supplements whenever possible.